So what I want to do here is demonstrate sort of in a nutshell my approach to evaluation and how easily evaluation leads into treatment. But we're going to cover a lot of different things here, including the concept of connecting with something, not what I feel is important, but what Melissa feels is important in a way that she feels hopefully that my stretch, my pressure, my engagement feels useful or helpful. So we did have a little discussion first of all before we started about what we're going to be doing here. She said it was okay for me to put my hands on her and for her to lean back into my chest with a pillow barrier here. She understands that if anything is too much or not right, she's going to tell me. We're looking to connect with irrelevant symptoms, and Melissa shared with me that she's got an issue where sometimes it feels a little difficult to swallow on the left side of her neck. I think you described it not as pain, correct?
No.
How did you describe it?
More pressure.
More pressure, okay. And at rest right now, Melissa, if you tried to swallow, would you feel that?
It's okay right now.
Not really. So you really don't feel anything at all, correct?
No.
So what I'm going to try to do here is actually bring that sensation to your awareness. It should never feel like it's too much or not right in any way. Now, I talk at length in my seminars about using nonverbal communication. As soon as I sit Melissa up and I'm behind her, I lose the complete ability to see her face. I actually work with a mirror in front of me. The way the video camera is set up right now, you can't really see that dynamic, but I love to have that mirror. It's a full-length mirror, either a door mirror or a rolling mirror. That couple of reasons for it. Number one, I can see Melissa's nonverbals in her face if I'm getting close to something that might be important or relevant or painful. Sometimes the nonverbals cue us in first, but just as importantly, I'm behind Melissa. She can't see me. There's less of a sense maybe of safety for Melissa. So the mirror gives her the ability to see where I'm at and what I'm doing. And I think it's a win for both of us. And I think it's something you might want to try in your own practice. So Melissa, what I'm going to be doing is putting my hands on this part of your neck. Relax your head into the pillow if you will. That's it. Good. Now, the first thing I do is do nothing when I put my hands on Melissa's neck. If there's any sense of guarding or threat, I want her to feel like I'm not going to hurt her. There's no midline pressure whatsoever. I'm coming in a posterior lateral aspect of the laryngeal region, thyroid cartilage, forward of the cervical spine. I'm comparing left and right, sort of assessing lateral mobility. That feels interesting right now, right there. Now, even though Melissa talked about left-sided symptoms, there's a little bit of tightness right in that area, up under the base of my right thumb. What are you feeling?
It definitely feels tighter.
It feels tighter. Is that feeling of tightness familiar to you?
It feels like a good stretch right now.
Feels like a good stretch, but more than that, it's not replicating a familiar symptom.
No.
Okay, so I don't necessarily treat from that perspective. Let's go over and see if we can connect with that difficulty swallowing. So in my mind right now, I'm feeling something. I'm feeling a piece of frozen chicken, some density, some tightness, a grumpy area, but I put less weight into what I feel, and all I do is simply put a little bit of stretch. And Melissa, what are you feeling?
I definitely felt a little kind of knot, I guess.
A knot.
On the left side.
Yeah. Is that familiar to you?
Mm-hmm.
Is it part of that swallowing issue?
Yeah.
Good. Does it feel safe?
Mm-hmm.
Yeah. 0 to 10, how much pressure am I using?
5.
A 5. All right. What number would you stop me at?
Probably a 7.
A 7. Mm-hmm. Would you prefer that I backed away from a 5, or does a 5 feel safe?
This feels safe.
Okay, it feels safe, but does it feel like it's doing something? Does it feel like it might be a helpful stretch?
Yes.
Is there anything about this stretch that feels like it might be harmful to you?
No.
Okay, so she established that it's familiar, it's relevant. She said the pressures, a 5 is a little higher than I might want to go, but she said it feels very safe. She'd stop me at a 7 or 8. It feels like it might be helpful, but not harmful. Does it feel like it might help with that swallowing issue?
Mm-hmm.
Good. And that's what I wanted it to tell me. Some patients don't always know if the stretch will feel helpful. They leave it up to us. All right, I'm willing to accept that, but I want to make sure there's nothing about what I'm doing that feels like it might be harmful or hurtful. If it does, I want to stop it immediately. What am I doing? My hands look like they might be motionless. I'm going to come off for a second. There's an area in through here that when I put pressure in a bit of a stretch in that direction, that's when Melissa said, yeah, that's that swallowing feeling. So evaluation in this sort of approach immediately and instantly leads into treatment, because whatever I did for Melissa to say, yeah, that's some of that feeling that I was talking about, becomes the starting point for treatment. I may not stay here. Over time, we might dance a little bit. And when I say dancing, it's simply moving into other areas. And I'm watching Melissa's nonverbals in the mirror there to make sure I'm not threatening or provoking anything. I'm dancing. I'm looking to see if there's something that I can do that feels even more useful or useful in a different way. The treatment can continue on for a long period of time. The treatment could be passive, it could be quiet, meaning she could sit here at rest, or maybe Melissa wants to try and swallow through this, right? If it was a vocal issue we were dealing with, she may want to try talking while I'm doing this. She may want to try singing or making various other noises or movements with her neck and throat. Things that feel familiar as a part of why she's in here in my clinic seeking treatment. Versus her just being quiet, we can have her in action. Action can be movement, but action can be swallowing, singing, talking, maybe just taking a deep breath. Whatever it is that brought her into my office, I want to see if we can connect with those symptoms and make a difference.